I'm Dr. Max Lane. I'm a consultant oncologist at St Elsewhere's, a large and important teaching hospital in London. I've been an oncologist for 20 years. And when I started, I wanted to make a difference, not only to patients' lives, but also to the fast-developing research. And I have. I'm well respected by my peers, and I have a good national and international profile. This hospital knows I'm a massive asset, and most of the time I'm recognized for the research funds I bring in here. About 2 years ago, I started hearing about a new drug, Fesolin, which was being trialled in the States. There's evidence that it significantly prolongs life by up to 6 months in patients with end-stage disease, where the standard treatments are no longer beneficial. But it hasn't been approved by NICE yet. Apparently, it's not cost-effective, and with all the pressures on funds, they can't justify its use. So there's no NHS funding. For me, that's not good enough. I know it's the best course of treatment for some of my patients. Full stop. I feel so strongly about this that I brought it up at several clinical meetings. I've even been to see the senior management team quite a few times. Well, they all listen, of course. I'm too high profile for them not to. But they're not prepared to do anything. And now they've stopped pretending they're going to. So, I've arranged to see my MP. I've written to the Times, to the BMJ, and they haven't printed anything. I've also written to NICE. I've involved my patients, patient advocate groups. And last night, I gave an interview to the local TV. You've got to get your opinions over somehow, haven't you?
I'm supposed to be going off-site for our board meeting, but I've just had a call from a television station asking me to comment on a story they're going to run tonight. Well, apparently our dear charming Max Lane has been speaking to the press about the wonder drug Fesolin and how it would prolong the life of every one of our patients if only we'd fork out the money to pay for it. I know. That's all I need. I'm Rosie Vincent. I'm an ENT surgeon and a medical director here at St Elsewhere's. Max Lane is a great consultant. He's well respected by patients and most of the staff here. But if I'm frank, he can be a pain. Over the past few months, I've received at least 20 letters from him about this Fesolin drug, and I've been copied into every single letter he's written about it. But it's not just that. Max is a bit of an eccentric. His secretary, the lovely Margaret Simmons, has always managed to keep him in check. She's absolutely devoted to him. But she retired last year. And without her, he seems lost. When Max wants to be, he can be charm personified. And to be honest, that's probably why he can talk his way out of every single concern that I've tried to raise with him. And not just me, but the clinical director and HR staff. He doesn't keep a diary. He forgets multidisciplinary team meetings. His clinics go on for far too long, creating havoc around him. We've looked at time management systems for him, but he's digging his heels in. And to top it all off, I bumped into his SPR earlier this afternoon, and he told me Max lost his rag on a ward round again because his new secretary bleeped him about a management meeting he was already half an hour late for. Apparently, he yelled at her from a patient's bedside, and she's off in tears and talking about a bullying claim.
Hello? Yeah, I know it's important. So why are you telling me this now? This should have been dealt with earlier. So why didn't you remind me earlier?
Come in. Oh, hello, Max. Thanks for coming. Please have a seat.
Hello, Rosie. How are you? You're looking well. Nice to see you.
Thank you.
Oh, and thanks for asking to see me.
Well, I thought it was important that we meet quickly and discuss recent events.
It is. So you've seen the coverage. I've been canvassing for the hospital and for the use of Fesolin in the treatment of our cancer patients. I think with public and patient support, it's only a matter of time before our approval is authorised.
Max.
Rosie, are you annoyed because I didn't run this past you first? I presumed you'd be too busy to give it your full attention.
I'm not going to get into a discussion about whether you're going to the local press and TV is the right or wrong thing to do.
Oh?
I need to speak to you about your team and their concerns about the aggressive and rude way in which you speak to people, in particular your secretary.
I'm sorry? This is about my dippy secretary and how useless she is.
From what I've heard, Max, your treatment of her is bordering on bullying.
I'm trying to get her to work better.
We've spoken about this before, and there have been discussions before between the clinical director and yourself and the HR director about the way in which you express your opinions. I'm really very disappointed that we're here again.
And I'm disappointed at having to listen to you bleat on. The only thing I've ever tried to do is the right thing for this hospital and the patients.